Assalamu alaikum. How are you guys doing? I hope you're doing fine. I know CVP has been stressful so far, and I can see that you guys are working hard. And here's where we come in to help you guys, inshallah. My name is Maarouf. I'm a third-year medical student. A lot of you guys, like I know a lot of you guys by now. Come on, a lot of you guys know me as Lotus's sister. A lot of you guys came up to me who said hi, thinking I'm Lotus. I'm very glad to be giving you guys this session today. From my understanding is that a lot of you guys faced trouble with this session. I'm not, it was given before your midterm, صح? I remember it was very crammed, or like 2 days before your midterm, a lot of you guys had trouble with that. Inshallah today, we'll break it down bit by bit. We'll make it very simple. One thing you guys will notice when going through my slides is I really try to use simple terminology as much as I can, because the way I write my slides is my thought process, okay? It's not like reading a textbook, it's like my understanding. I really hope this will help you guys. I think this is the simplest way to do it. Without further ado, let's get started. Before we start anything, there's this concept that I want to orient you guys to, okay? When our body position changes, let's say you were lying supine and now you're standing up, okay? When your body position changes, the blood distribution in your body changes as well, okay? So you were lying down, you stood up, the blood will move down to your legs now, right? So this just means that the blood distribution in your body changes, okay? When you're lying down, when you're walking, when you're standing, okay, the blood distribution changes. طيب? Now, when your blood distribution changes, this leads to a change in the mean arterial pressure, okay? So what I want you guys to know from now till the end of the session is that when our body position changes, this will result in changes in our blood pressure, okay? طيب. Now that you guys know this, we can start. طيب, like we said, when you stand up, blood moves down to the legs. Why does this happen? Obviously, there's a reason this happens, right? طيب. There are two reasons. One of them is gravity, okay? So we all know what gravity is. It's gonna pull the blood down. طيب? This is one reason. The other reason is that veins have high compliance. Now, you guys took this in histo. Compliance means that a vein can stretch easily, okay? So even if you fill it with a lot of blood, it will still be able to accommodate that blood. Why? Because this is like one of its characteristics. It has a lot of elastic fibers and it's able to stretch very easily. So it can very easily hold a lot of blood, okay? So again, we said there are two reasons that blood moves down to the legs. One of them is gravity will pull the blood down, and one of them is that veins have high compliance, so they will be able to stretch out and hold all that blood in them, okay? Now, after the blood goes down to the legs, what happens? We will have a decrease in three parameters, okay? One of them is venous return. Now, what is venous return? Venous return is basically the amount of blood that goes back to the heart. Now, if you guys think of it by logic, obviously venous return will decrease. Why? Because the veins in the legs are holding out a very big amount of blood, right? So venous return will decrease. طيب? Next, we have cardiac output will decrease. What is cardiac output? It's the amount of blood that the heart pumps every minute, right? طيب. Again, by logic, if venous return decreases, if I'm not filling the heart with enough blood, the heart will not be able to pump out enough blood. So cardiac output will decrease. Also, mean arterial pressure will decrease. Why? Because if I'm not sending out as much blood to the organs and the arteries, the pressure will decrease. Is everything clear so far? Just say yes in the chat, okay? Okay. طيب. Okay, let's move on. Now, what will the body do now that we have a decrease in venous return, cardiac output, and a decrease in mean arterial pressure? This is very important, the decrease in pressure. Now that the decrease in pressure happened, the body will detect this, right? So it will activate the baroreceptor reflex. Now, before talking about the baroreceptor reflex, I want you guys to tell me, what is a reflex? You can unmute or in the chat, it's up to you. Okay, so basically a reflex is a response to a stimulus, okay? Let's say you were heating up some food, you took the food out of the microwave, it was very hot, and the second you touched it, the plate drops down to the floor. Why did this happen? This was a reflex because your body was able to detect that this plate is very, very hot, and your body was able to detect that this will harm it, okay? Because it's very hot, it will burn, right? So this was the reflex that was initiated. You drop down the plate as a protective mechanism to protect yourself. Same way, when the mean arterial pressure drops down, the baroreceptor reflex is initiated. So the baroreceptor reflex, the aim of this reflex is to bring back the blood pressure back to normal. Because when blood pressure drops down, and if it remains down for a long period of time, or for just enough time, this can be very, very detrimental. It can be very dangerous. So our body will try to correct that, okay? So now that the baroreceptor reflex is initiated, and we'll talk more about it, we'll explain it in depth. What happens, what is the effect of the baroreceptor reflex? 3 main things that are very, very important, okay? You have to know them. One of them is that the heart rate increases. So the heart will start beating at a faster rate. Next, the contractility increases, so the heart will pump out harder. If heart rate increases and contractility increases, by logic, I can tell that this will increase cardiac output. This is simply by Frank Starling's law. If I am increasing heart rate, if I'm pumping out harder, I'm obviously going to send out more blood, right? One more parameter that will increase, and this is very, very important, is total peripheral resistance. So total peripheral resistance will have 2 effects. One of them is that it will constrict the arteries, and when you constrict the arteries, the pressure inside them will increase. That's number 1. Number 2, it will constrict the veins, okay? When we increase total peripheral resistance, we're constricting the veins. If I'm constricting the veins in the leg, remember I said the veins in the leg, the high compliance ones, the ones that are taking in a lot of blood, if I constrict them, I'll send out all that blood back to the heart, right? So I will increase venous return. So this is why increasing total peripheral resistance is important. So we'll increase heart rate, contractility, and total peripheral resistance. When we increase resistance, what is the effect? One of them, it will constrict the arteries to bring the pressure back to normal. One of them, it will constrict the veins and to send that blood back to the heart, okay? What is the result of this? Venous return goes back to normal, so I'm sending the blood back to the heart. Cardiac output goes back to normal, so I can pump out enough blood, and mean arterial pressure goes back to normal, okay? This is the aim of the baroreceptor reflex. So this is everything we just explained. I know that some of you guys had a lot of trouble with Dr. Simon's mind maps, and he did say that these are very important and you have to know them very well. That's why I broke it down bit by bit. Now that we already explained everything, this is just a recap. So like we said, you stand up, the blood pulls down in the lower extremities, it's going down. صح? Why does it go down? Because of gravity and because of venous compliance. So the veins are able to stretch out very easily and take all that blood in them. What effect will this have? Venous return will decrease, cardiac output will decrease, and mean arterial pressure will decrease. When mean arterial pressure decreases, this will initiate a reflex. What is that reflex? The baroreceptor reflex. Now we said the baroreceptor reflex has very, very important 3 effects. What are they? They'll increase heart rate, contractility, and total peripheral resistance. When all of these increase, we will be able to take the venous return back to normal, cardiac output back to normal, and mean arterial pressure back to normal. Is everything clear? Do you guys have any questions? Because this is very important so that you can understand the rest of the presentation. Is everything clear? I'm not sure how I can see the chat that I have this. Okay.
Yes.
Okay.
Yes, it's clear.
Okay, خلاص, amazing. Now that this is clear, this brings us to our first checkpoint, okay? When a person moves from a supine position to a a standing position, which of the following compensatory changes happens? Can you guys answer in the chat or unmute yourself? Okay, any more answers? So one of you guys answered and they said that the answer is, just let me check the chat again. Okay, so we have different answers here. The answer is B. Why is the answer B? Because like we said here, we said contractility increases when the baroreceptor reflex is initiated. This is just something that you have to know, okay? You answered E. Someone answered D. Yeah, someone answered D. Here the question was asking compensatory changes. So a change that will happen so that we can compensate and bring blood pressure back to normal. Decreased cardiac output is something that will happen because we stood up. So I want to correct this, okay? The question was asking about a compensatory change. I think maybe you misread the question, but the question here is asking about compensation. So what is the body trying to do to correct the blood pressure, okay? Is everything clear, guys? Right. Yalla, we'll move on to the next concept. Okay. Now, this is what it looks like when you're lying supine. Lying supine just basically means, imagine yourself sleeping, that's lying supine. Now, what do you need to know about lying supine is that there will be no difference in arterial and venous pressures in the body. What does this mean? If you look at an artery in the head, or at an artery in your arm, or in your hand, or in the legs, or in the feet, all of them will have very similar pressures. There won't be a change, both in arteries and veins, okay? But when you stand upright, there will be a change in pressure, okay? Why does this happen? Because like we said, there's the factor of gravity. So gravity will affect the blood pressure because it's pulling that blood down. So as a result, all the vessels that are above the heart will have a reduced blood pressure, and the vessels that are below the heart will have an increased blood pressure, okay? So when you're lying supine, there isn't a difference in the blood pressure in all arteries and veins throughout the body, but when you stand upright, the pressure will change because of gravity. So the arteries and veins that are above the level of the heart will reduce, the blood pressure will reduce, and if it's below the level of the heart, the blood pressure will increase. Now, something to note is that blood pressure changes by 0.78 millimeters mercury for every 1 centimeter change. What does this mean? This rule, why is it important? It's just so that I can measure the separate pressures of arteries in the body. Let's say I want to measure the pressure of the cranial artery in the head, or the dorsalis pedis artery in the foot. Okay, you don't need to know these names or these specific arteries. This is just a concept, okay? If you want to measure the pressure in them, you will see how far away are they from the heart. So let's say it's 15 centimeters away from the heart, okay? So you'll multiply 15 times 0.78. Why? Because every centimeter change in distance will come with a 0.78 change in pressure. Is this concept clear? We'll practice now, but I just want to know if you guys understood what I mean. Just reply in the chat, guys, or unmute yourselves. I just want to make sure that you understood this because, okay. So this is also very important. It's an important concept when it comes to measuring blood pressure. This is why when we measure blood pressure, we take it at the level of the heart. You guys will take this in second year in pro. When you learn how to measure blood pressure, they'll tell you it's always important to keep the arm of the patient at the level of the heart. Why is this important? Because this is the most accurate reading of blood pressure that we can get. Because if the patient lifts up their arm a bit, there will be a change. It might decrease a bit. And if they put their arm down a bit, it might increase a bit because it's going down below the level of the heart, okay? So this is, all you need to know from this point is that blood pressure is most accurate at the heart level, and this is where we measure it. Now, for the other point, we'll practice now. So I want to measure the pressure of the cranial artery in the head, and I know that my mean arterial pressure is 93. And I know that this cranial artery is 25 centimeters above the heart. What will I do here? What's the first step? Okay, if you guys don't know this one, it's fine. We have another example. Exactly, multiply 25 by 0.78, okay? So now I know that there will be a 20 millimeters mercury change in pressure. طيب. There's a second step. Now I'll take the mean arterial pressure and it's above the heart, okay? So the pressure is increasing or decreasing? If it's above the heart, is the pressure increasing or decreasing? Decreasing, exactly. So I will do 93 minus 20, and this will be the pressure in the cranial artery. Do you guys get this concept? Because I have a question now and I want a volunteer to answer. Someone brave, unmute themselves and answer, okay? Yeah. By the way, you don't need to give me the
I can answer the question.
don't give me the numbers, يعني, it's fine. Just give me the technique. Yeah.
Okay, it's 103 centimeters below the heart.
Mm-hmm.
So we multiply 103 by 0.78.
Okay.
And then we take the mean arterial pressure and we add the number because it's below the heart, not above.
Exactly. Perfect. You explained this perfectly. This time we added the pressure because it's below the heart, and we said when it's below the heart it will increase, not decrease. Okay. But now that we're done with this concept, we'll move on to the baroreceptor concept. But before starting, I just want to orient you guys to what baroreceptors are. Baroreceptors are essentially stretch receptors, okay? So they are located in a few locations in our body, and they detect the degree of stretch. طيب? So if I have high blood pressure, those baroreceptors will be stretching a lot because there's the blood is pushing on them and it's creating this large degree of stretch. So they will fire, their firing rate increases, okay? But if my blood pressure decreases, the degree of stretch will go down, okay? So their firing will decrease. Now, this is something about the baroreceptors, okay? طيب. Now, I want you guys to know who the baroreceptors report to. Think of the baroreceptors as employees, and they are basically reporting back this information to the office, okay? Who's this office they're reporting to? It's the nucleus tractus solitarius in the brainstem, okay? This is basically an integration center. So they'll send out the signals to the nucleus tractus solitarius, and based on the signals, the nucleus tractus solitarius will exert its effects through sending signals to other areas, okay? We'll talk about them all, but I just want you guys to know that baroreceptors are stretch receptors. They detect the level of stretch, and they send out this information to the nucleus tractus solitarius. A funny way you guys can remember it is, I'm pretty sure most of you guys are now familiar with the MSA. So think of the baroreceptors as the different committees, okay? So you have G&D, you have academic aid, you have PR, and all of these committees are reporting back to PO, okay? So nucleus tractus solitarius is the PO of the situation, okay? But now that you guys hopefully understand what baroreceptors are, now we'll go down to the specific mechanism of how they work, okay? So let's say there's a decrease in blood pressure. Baroreceptors will instantly detect that because there's a less degree of stretch. So when the baroreceptors are stretching less, they're detecting a lesser amount of stretch, and the degree of stretch is going down, they will fire less. So when they fire less, they will send out less signals to the nucleus tractus solitarius, okay? So decrease in blood pressure. Baroreceptors will detect that, so they will fire less, and they will send less signals to the nucleus tractus solitarius. So now the nucleus tractus solitarius has lesser stimulation, okay? It's not stimulated as much because it's getting lesser signals, okay? So the nucleus tractus solitarius will send orders to two places, okay? One of them is the cardioinhibitory area. So it will it will decrease the activation of the cardioinhibitory area. I do not want to activate the cardioinhibitory area right now. Why? Because from the name, cardioinhibitory, this will decrease the heart rate, and I don't want to decrease the heart rate right now. My blood pressure is decreased, and I want to increase the heart rate to compensate for that. So I don't want to activate the cardioinhibitory area, so there will be less activation. The other place is the vasomotor center. Like, now, you guys will take this in second year in neuro. I won't go into the specifics, but just something that you have to know about the vasomotor center is that normally it is under inhibition, okay? It's not firing normally. But when we detect a decrease in blood pressure, the nucleus tractus solitarius will decrease that inhibition. So I want the vasomotor center to start firing, to start working, okay? So I do not want to activate the cardioinhibitory area, and I want to activate the vasomotor center, okay? طيب. Now, basically, this says that inhibition of GABAergic interneurons will decrease. You don't need to know this, just know that it will fire more, okay? Just know that the vasomotor center will fire more, okay? طيب. Now that the vasomotor center is firing more, it will increase activity to the bulbospinal pathway, okay? When it increases the activity to the bulbospinal pathway, this will have two effects. One of them is that it increases the sympathetic activity and decreases parasympathetic activity. Now, why do I want to increase sympathetic? Because sympathetic activity will increase the heart rate, will constrict the blood vessels, will increase contractility. And I want all of these stuff. Parasympathetic does the exact opposite. I do not want to decrease my heart rate right now. So the bulbospinal pathway will give less activation to parasympathetic, more activation to sympathetic. What does this lead to? An increase in heart rate, contractility, cardiac output, and total peripheral resistance. When I increase all of these parameters, mean arterial pressure goes back to normal. So again, like we said, the baroreceptor reflex, the aim of this reflex is to bring the blood pressure back to normal. So if blood pressure drops, baroreceptors will start firing less. Why do they fire less? Because they're not stretching out as much. They're not detecting a big degree of stretch. So they fire less. They will send less signals to the nucleus tractus solitarius. This is the big boss, the office, okay? They need to tell the nucleus tractus solitarius everything. So nucleus tractus solitarius will be less stimulated right now, okay? So it will send two orders. It does not want to activate cardioinhibitory. I don't want this to start working now, so there will be less activation there. And I want the vasomotor center to start working, so I will reduce inhibition there. I want it to work. When vasomotor center starts working, this will increase activity to the bulbospinal pathway, which will increase sympathetic and decrease parasympathetic, increasing heart rate, contractility, cardiac output, and total peripheral resistance, bringing mean arterial pressure back to normal. Is everything clear here? If you guys want me to repeat anything, any questions, let me know. I have to make sure that you guys understood this. So just reply in the chat if you guys understood this. Is it clear, guys? Okay, great. We can move on. We're now moving on to the concept of orthostatic hypotension, okay? What does hypotension mean? It means decrease in blood pressure, okay? Orthostatic has to do with our body position, okay? So like I told you guys in the beginning of the session, one concept that I wanted you guys to be familiar with is that blood pressure changes with our body position changes, okay? Orthostatic hypotension is when the body is not able to bring blood pressure back to normal with those body position changes. So like we explained already, when we stand up and blood pools in the legs, there are certain mechanisms that the body activates so that we can bring this blood pressure back to normal. One of them is the baroreceptor reflex that we already talked about. So when you change body position and the body is not able to bring blood pressure back to normal, because this is what should happen. The body should be able to bring blood pressure back to normal after the change in body position. If the body is not able to do that, This is what we call orthostatic hypotension. Now, why does orthostatic hypotension happen? It can happen due to two reasons. One of them is that the baroreceptor reflex is not working. So remember everything we discussed here. If this is not working, this can lead to orthostatic hypotension. The second reason is hypovolemia. What is hypovolemia? Hypovolemia is when we have less fluid in the body, okay? So hypovolemia can happen due to multiple reasons. One of them can be dehydration. It can be hemorrhage, so the person was bleeding out a lot. It can be excessive sweating. It can be diarrhea. So if a patient has diarrhea, they lose a lot of fluid because of that, okay? So any condition that will cause the person to lose a lot of fluid will lead to hypovolemia. And if a person is hypovolemic, they will suffer from orthostatic hypotension, okay? So if we said orthostatic hypotension is when the body is not able to bring blood pressure back to normal because of the body position changes, and it can happen due to two reasons. Either the baroreceptor reflex is not working, or the patient is hypovolemic. And we said hypovolemia can happen due to multiple reasons. Okay, so how does orthostatic hypotension happen? Now we know what orthostatic hypotension is. Now let's learn how does this happen, okay? What's the mechanism of this condition? So you stand up, blood moves down to the legs, gravity and compliance, like we already said, like we said this a million times by now. You stand up, blood moves down to the legs, gravity is pulling that blood down, and the veins can stretch out easily and take all that blood in, okay? Now, normally, the body should be able to compensate. But what happens here, the body is not able to compensate. This leads to venous volume in the legs being high and venous pressure being high. What does this mean? So when you take all that blood into the veins in the legs, the volume, the amount of blood in those veins is very high, okay? And when you have a lot of blood in those veins, the pressure in those very same veins will be high, okay? So always remember, when you increase volume, you're increasing pressure. So if you have a lot of volume, a lot of blood in those veins, the pressure in those veins will be high, okay? Now, this shift in blood volume will decrease thoracic venous blood volume, which will decrease central venous pressure. Like we said, volume and pressure go hand in hand. So when you're sending all this blood back, when you take all that blood to the legs, okay, the veins in the legs are taking in all that blood. The blood in the thoracic area, okay, we have veins in our chest, that's the thoracic area. They won't have as much blood because most of the blood is sitting in the veins in the legs, okay? So when they don't have that much blood, the pressure will decrease. And we call that central venous pressure. Central venous pressure is the pressure of the thoracic veins, okay? So when you don't have a lot of blood in the thoracic veins, the central venous pressure will decrease, okay? This will lead to a lot of things. Right ventricular pressure will decrease because you're not filling the right ventricle with a lot of blood. Right atrial pressure will decrease as well. Why? Because normally I should be sending this blood back to the heart, right? And when it goes back to the heart, it goes to the right atrium, then to the right ventricle, okay? So if I'm not sending that blood back to the right atrium and right ventricle, right atrial pressure will decrease, right ventricle pressure will decrease, venous return will decrease because the heart is not taking that blood back, and end diastolic volume will decrease, which is basically the amount of blood at the end of relaxation, okay? All of them decrease. And when they decrease, this leads to stroke volume decreasing. Stroke volume is basically the amount of blood that is pumped out of the heart with every beat. This makes sense. Why would stroke volume decrease? Because I'm not filling the heart with enough blood. So obviously stroke volume will decrease. What does this lead to? This leads to cardiac output and arterial pressure decreasing, okay? So when they decrease upon standing, this leads to orthostatic hypotension, okay? So basically, the main problem here is that the body is not getting enough blood because the cardiac output has decreased, okay? So when cardiac output decreases and it's not sending out that much blood to the arteries, to the organs, the arterial pressure will drop because there's not enough blood in those arteries, okay? And this will lead to hypotension, okay? This is because the correction mechanism that we had, the baroreceptor reflex, is not working, or because the body does not have enough blood, okay? Hypovolemia, okay? Is this clear, guys? Okay. So now we can move on to, this is a very similar concept, okay? It's just we're looking at it from a different perspective now. So let's say you stand motionless for more than 5 minutes. This basically means you're standing with no movement at all, okay? You're standing motionless for more than 5 minutes. What would happen? Okay? First of all, venous pressure in the legs will increase. Why does it increase? Because, like we said, the blood is moving to the legs. So there's a lot of volume there in the veins in the legs, okay? And that will lead to the pressure being high, okay? This will lead to the capillary hydrostatic pressure increasing in the legs. Now, do you guys remember what hydrostatic pressure is? Capillary hydrostatic pressure? Okay, so if you guys don't remember what capillary hydrostatic pressure is, it's basically, let's say this blood in a capillary, okay? It's exerting pressure on the walls of the capillary, okay? So when it exerts that pressure on the walls, this is called hydrostatic pressure, okay? And hydrostatic pressure normally acts as a filtration force, okay? And this is the next point that we were coming to. Because the hydrostatic pressure increases, net filtration increases. So the capillaries are filtering out that blood. So we're losing a lot of that fluid because of this filtration. Okay? So this will lead to the venous blood volume decreasing. Remember how we had a lot of venous blood volume in the beginning and the venous pressure increased? Now, because of that pressure increase, hydrostatic pressure increased. So it started pushing on the walls and this led to filtration, okay? So because filtration is happening, we're losing that fluid. So venous blood volume will now decrease, okay? The amount of blood in those veins will decrease. This also leads to the central venous pressure decreasing. Now, like we said, the thoracic area has veins, and the pressure in those veins is the central venous pressure. Now, this already decreased when the blood was pooling down in the legs, but imagine how much more it will decrease when even those veins in the legs have even lesser volume right now because of the filtration that's happening. Why did filtration happen? Okay, so filtration, the hydrostatic pressure is what caused net filtration, okay? This is a different lecture. I'm not sure what the lecture is, but basically, capillary hydrostatic pressure is a force, okay? So think of the blood sitting in this capillary, okay? The amount of force this blood is exerting on the walls of this capillary is what we define as hydrostatic pressure. And something that you just need to know, this is like a rule, okay? Capillary hydrostatic pressure is a filtration force, okay? This is why filtration happened. Is this clear? I'm not sure who asked me, but I'm hoping you understood this concept by now. If not, I'll come back to it in a bit. Okay, got it? That's perfect. But central venous pressure decreases, like I told you guys. So this will lead to the venous return and cardiac output decreasing. Why? Because I'm not returning as much blood back to the heart. That's venous return. The heart is not receiving that blood back. And cardiac output will decrease as a result. Because if I'm not getting in enough blood, I won't send out that blood, okay? This leads to less blood flow to the brain, okay? Because cardiac output decreased to all the organs. But it's very, very important specifically to the brain. Because when we have less blood flow to the brain, this leads to syncope, which is basically fainting, okay? So do you guys have any questions? Is this concept difficult? Or do you think you got it? I can repeat if you didn't understand. Just let me know, please. Okay. خلاص, perfect. Okay, now moving on to this is, I believe, okay, we're nearing the end, guys, يعني. Good job. Mechanisms to reduce venous pooling. أول شيء, what is venous pooling? Venous pooling is when the blood goes to the veins in the legs. That's what we call venous pooling. And why does venous pooling happen? Because, like we said a million times, high compliance and gravity, okay? So the body has ways, يعني, God created us with certain mechanisms to decrease this venous pooling. We don't want this blood to stay in those veins, okay? So one of them is the skeletal muscle pump and the thoracic muscle pump. We'll start with the skeletal muscle pump, okay? So you guys can see this is a muscle, and this is the vein. That's the blood sitting in the vein. And those are one-way valves, okay? So when you're walking, those muscles will start contracting, right? And when those muscles contract, they're pushing on this vein. You guys can see it's squeezing the vein, okay? So when you're pushing on this vein, the blood inside the vein will start moving up, okay? It's going back up to the heart. That's one way. Also, there's one-way valves. So once the blood goes back up and the valve closes, it will not, once the blood goes back up, if regurgitation happens, the valve will close and it will not allow this blood to go back down, okay? So the muscle is contracting, it's squeezing this vein so that the blood can be sent back up. And if regurgitation happens, the valve will close and it will not allow this blood to go back down. What does this lead to? This will increase venous return. Why? Because I'm forcing this blood to go back to the heart. So venous return increases. This will also decrease venous volume and pressure in the legs, because this is how much blood I had. And then when I'm contracting the muscles and sending all that blood back up, I won't have as much blood left in the veins, okay? So this will decrease the volume in those veins. When I decrease the volume in these veins, the pressure will also decrease, okay? And like I told you guys, veins have valves. So if the blood wanted to regurgitate to go back, the valve will close and it will not allow this to happen. That's for the skeletal muscle pump. The other mechanism is the thoracic muscle pump. This is basically, wouldn't the muscle constricting the veins bring the pressure up? This is basically the concept that we're talking about. Because the muscles contracted, they pushed on that valve, right? They pushed on that vein. They're constricting that vein. They're increasing the pressure in that vein. So the pressure in this vein is very high right now. So it's increasing and increasing to send that blood back to the heart. Okay, so the concept that you need to know here is that when the muscles are contracting, they're squeezing this vein and sending this blood back to the heart. They're forcing this blood to go back to the heart. So yes, you are right. The pressure does increase in this vein, but it's not contraindicating. It's not contradicting anything that we already explained. Basically, the pressure increasing in this vein will help us, because when the pressure increases in this vein, we're sending this blood back up. Okay, but when all that blood goes back to the heart, we're left with not so much blood in those veins. That's why the pressure decreases. Okay, I got your point now, like your question. But basically, that increase in pressure will happen only when the muscle is contracting, okay? So once that blood is sent back up, the venous volume will decrease because that blood is no longer here in the vein. It went back to the heart. And this is why the pressure will decrease, okay? Did you understand? Okay. Now the thoracic muscle pump. This is what we call the respiratory pump, okay? The way this works is due to changes in intrathoracic pressure upon inspiration. So intrathoracic pressure is the pressure in our chest area, okay? So when we inspire, or when we breathe in, okay? When we breathe in, intrathoracic pressure will change, okay? And this change in intrathoracic pressure will affect central venous pressure and venous return. Now, what is central venous pressure? I told you guys we have certain veins in our thorax, and the pressure in those veins is what we call the central venous pressure, okay? So One thing that you have to know is that inspiration affects the central venous pressure by affecting the pressure in the thorax, okay? How does it happen? We'll break it down bit by bit now, okay? So deep inspiration, you took a deep breath in, okay? Intrathoracic pressure increases, okay? Just a second, guys. Okay, because I saw that there was an error in the slide and I didn't want it to confuse you guys. I could have continued explaining, but I wanted to change it because in case you guys looked at the slide again right now, I didn't want you to be confused. So deep inspiration, the intrathoracic pressure will decrease, okay? Why does intrathoracic pressure decrease? Because your diaphragm flattens, okay? So when your diaphragm flattens and your ribs are they're lifted up, okay? When you take a deep breath in, the pressure in the thorax will decrease, okay? So when that pressure decreases, the pressure in the right atrium decreases as well, okay? So just imagine you took a deep breath in, the pressure in your thorax will decrease because the diaphragm has flattened, okay? So this will lead to the pressure in the right atrium decreasing as well. This will lead to a high driving force, okay? So let's think about this for a minute. You guys know what a driving force is. It's basically the difference in pressure between two locations, okay? So if I have a very high pressure down in the legs, okay, and a low pressure in the right atrium, this will cause a very big difference between them, right? There's big difference in pressure between them. So the driving force is very high. This will cause the blood to go from the legs back to the heart, okay, in the central venous space. Do you guys understand this concept? It's basically because we took a deep breath in and the pressure here decreased, this caused a driving force. Why is this driving force very high right now? Because the pressure in the veins in the legs is very high and the pressure in the right atrium is low. So there's a very big difference between them. This will cause the blood to move back to the heart. Do you guys understand this? Just let me know if you understood. If not, we'll repeat, okay? Just type in the chat or someone unmute, okay? Okay. So yeah, don't confuse this because this was an error in the slide. The intrathoracic pressure will decrease, okay? And this is why the right atrium pressure decreases, causing the high driving force, okay? This is essentially everything we explained till now. Let's say I'll give you guys a quick recap and then we'll move on to questions. So a person was lying supine, now they're standing. When they are standing, gravity takes that blood to the legs. Compliance will also allow that blood to stay in the legs. This will decrease central venous volume and pressure. Why? Because the blood is now in the legs and not in the chest anymore. So the central venous volume will decrease and the pressure decreases as a result. This will cause low venous return. So blood is not going back to the heart the way it should because it's staying in the legs. Cardiac output decreases, so I'm not pumping out enough blood. And mean arterial pressure decreases as well. This will lead to syncope when I don't get enough blood to the brain, okay? This will lead to decreased baroreceptor activity. They are not detecting a high degree of stretch. The degree of stretch is very low, so they will fire less and they will send less signals to the nucleus tractus solitarius. The nucleus tractus solitarius will send orders to two areas. It inhibits the cardioinhibitory, so it decreases the activity there. I don't want this to work. And it increases the vasomotor activity. I want this to work. When vasomotor activity increases, it increases the bulbospinal pathway, which will increase sympathetic. I want sympathetic to increase here. This will lead to the heart rate increasing, contractility increasing, and total peripheral resistance increasing. And as you can see, this also, when we increase the activity in vasomotor, we increase sympathetic, decreased parasympathetic, And when we decreased cardioinhibitory, we also decreased parasympathetic. So the end result is high sympathetic, low parasympathetic, which leads to high total peripheral resistance, constricting the veins, constricting the arteries. When you constrict the arteries, pressure decreases. When you constrict the veins, you're forcing that blood to go back to the heart. When you're increasing contractility, the heart pumps stronger. When you increase heart rate, the heart will beat faster and stronger. So this will lead to increased stroke volume and eventually increased cardiac output. So eventually we'll be able to send that blood back to normal. This will counteract the reduced cardiac output and venous return, okay? So now that we sent out that blood, we are able to increase that amount again. Mean arterial pressure will go back to normal. Do you guys have any questions or any doubts? Okay. Now we'll move on to questions, okay? So, I want someone to volunteer and read this question, please. Just unmute yourself and go ahead. Yalla, guys, I'll pick randomly if no one volunteers. Adi, guys, even if you get it wrong, it's fine.
I can read it.
Yalla.
A 17-year-old girl with orthostatic hypotension present with the complaint of multiple syncope episode over the past month when standing up. To prevent syncope, which of the following changes to cardiac output, arterial resistance, and venous compliance occur as a part of the normal parareceptor reflex in a healthy person when standing up?
طيب. So what this case is saying is that this girl has orthostatic hypotension and she's suffering from syncope because of her orthostatic hypotension. So what the question is asking here is what is a part of the normal baroreceptor reflex? Yani literally, if you read just this line, you'll know what the question is asking for. So what's the answer? Yalla, guys, what's the answer? You can type it in the chat. B. Okay. Any more answers? C. طيب. Okay. The answer is actually C. Good job, guys. Someone said B, صح? Let me check. Someone said B? Okay. So the reason it is not B is because cardiac output increases, yes. Arterial resistance should increase, not decrease. Because remember when we talked about the three main things that will increase in the baroreceptor reflex, we said total peripheral resistance, venous return, and heart rate and contractility. So when we increase total peripheral resistance, this includes the arteries, right? This is why B is wrong. Cardiac output increases, arterial resistance increases, and venous compliance decreases. Okay, so I'm pumping out more blood. The resistance increases so that I can constrict the veins to send the blood back to the heart, and constricting the arteries to maintain the pressure, and decreasing venous compliance is because I don't want the veins to stay compliant. When I increase total peripheral resistance, I'm constricting those veins, so their compliance will decrease and I will be able to send that blood back to the heart. Okay? طيب. Next question. يلا, someone volunteer. يلا, guys.
Okay, I can read.
يلا.
A 16-year-old boy involved in a knife fight is transported to the emergency department. A severed artery in his forearm was bleeding profusely, but is now controlled. His blood pressure is 100/70 Mimi, I don't know what's this.
Millimeter.
Which of the following cardiovascular parameter will be lower during compensation for hemorrhage than before the hemorrhage?
طيب, what's the answer? Do you know the answer? It's okay if you don't.
A.
Okay. Well, I kind of revealed the answer, but I was hoping you guys didn't see it. But yes, it is A. Can you explain why is it A? It's okay. طيب, the question here is asking which parameter will decrease during compensation than before the hemorrhage. Okay, so when the person was having this hemorrhage, when they were bleeding, okay, certain parameters were changing. During compensation, the question here is asking, during compensation, which of these parameters is lower? And this is A. Why is it A? Because when I told you guys, when pressure goes down, arterial baroreceptors, their activity goes down. They are firing less because there is a lower degree of stretch. Okay, this is why it will be lower here during compensation for hemorrhage. Okay. Right. Next question. We're almost done, guys. يعني بس بسرعة. طيب, يلا سعد. You go ahead. Just read the question وبعدين we'll discuss.
Okay. Can you hear me?
Yes.
Okay. A 22-year-old woman occasionally faints. Her resting blood pressure is 120/75 millimeter mercury, I think, and 95/60 millimeter HD after standing up. Her resting heart rate is 95 beats per minute and 115 beats per minute after standing up. Which of the following physiological cardiovascular changes most likely causes her abnormal response to the postural change?
Okay. Do you know what the answer is?
Would it be I have no idea.
Okay. That's fine. So the answer is A. Why is the answer A? What is the question asking for? They're saying which of the following physiologic cardiovascular changes causes her abnormal response to postural change, okay? So what's happening with her here, you can see when she was lying down, it was 120 over 75, and then it became 95 over 60 after she stood up. So when she stood up, her blood pressure went down, okay? Like I told you guys in the beginning, the blood pressure changes in terms of body position, okay? So when she stands up, there's a decrease in blood volume. Why is there a decrease in blood volume? Because all the blood is situated in the veins of the leg, okay? So the compliance in the veins of the legs is very low, right? Sorry, it's very high. So it's taking in all that blood. So as a result, venous return decreases. When venous return decreases, we're not sending the blood back to the heart, right? The heart is not being filled with enough blood. So cardiac output will decrease as a result as well. Because if I'm not filling the blood with, if I'm not filling the heart with enough blood, I won't be able to pump out enough blood. Okay? طيب. I think this is the last question. I'm not sure. Yellow. Someone volunteer. It's okay, guys. You can just read the question. You don't need to answer it. We'll discuss the answer together. E. Okay, you're right. Abdullah. Okay, bravo. The answer is D. Why is the answer D? In which of the following scenarios do both central venous pressure and venous return decrease? So it's when the person suddenly stands up compared to lying down. So I told you guys, when the person stands up, the blood pulls down in the legs. So when all of the blood is in the legs, the central venous pressure decreases because the blood is not in the the blood is not in the thorax anymore. The blood is in the veins of the leg, okay? So the central venous pressure decreases. And venous return decreases because, like we said, the blood is situated in the legs and it's not going back to the heart as much, okay? Yeah, طيب. يلا guys. Honestly, I'm not sure how many questions do we have, but يعني we should be almost done. You can answer in the chat. Take your time. This is a bit of a long question. Okay, so Saad said A. You're right. طيب, let's read the question. Can you read it? Can you please read the question? بعدين I'll discuss with you guys.
Okay. A 22-year-old man enters the hospital emergency room after severing a major artery in a motorcycle accident. It is estimated that he has lost approximately 700 milliliters of blood. His blood pressure is 90/55 millimeters Hg. Which of the following sets of changes would be expected in response to hemorrhage in this man?
Okay, so this man had hemorrhage, صح? What reflex was initiated?
Baroreceptor reflex.
Exactly, the baroreceptor reflex. So the baroreceptor reflex, I told you guys, the total peripheral resistance will increase, heart rate will increase, and sympathetic activity will increase through the bulbospinal pathway. So you are absolutely correct. Thank you so much. Next question. Take your time, guys. We'll answer in the chat. Okay. So you guys said E, and E is the correct answer. So basically, the case here is that the woman presents to the emergency department with diarrhea. And I told you guys, when a patient has diarrhea, they are hypovolemic. So you can expect them to have orthostatic hypotension. Okay, so this is what this case is about. She has orthostatic hypotension. So they are asking which of the following accounts for the further increase in heart rate upon standing. She already has orthostatic hypotension, right? So when she stands up, there is decreased venous return. Why is there decreased venous return? Because the blood is pooling in the legs, okay? That's in addition to her orthostatic hypotension. Her body is already not able to restore blood pressure back to normal because of the hypovolemia. And she's standing up. So there's a compensation happening here. Her heart rate further increases, right? So they're asking you, why is the heart rate increasing? It's because of the decreased venous return, okay? As a reflex, okay? We're done. This was it. I hope you guys found this beneficial. I know this can be a bit confusing. I'll send you guys the slides. And I hope that you guys benefited. If you have any questions, I left my contact information in the first slide. You can ask me anything. I'm more than happy to. Just send me whatever doubts you guys have. Do you guys have any questions, by the way? Today's slides, inshallah, on the drive. There's a drive that they'll be sending to you. Oh, I'll just tell them to send it on your announcements group to make it easier for you guys to access. I know that first year can be tough. I didn't like first year when I was the first year, so I really understand the struggle, but inshallah, into Adda. And I've seen how hard you guys have been working. So I wish you guys the best of luck. And please scan this code. It will not take more than 1 minute to fill. It's only one question. And that's